The Innovation Agency have been supporting us by funding rollout of our project across Cumbria, across South Cumbria and into North Lancashire. So we've been able to introduce the e-referral and resource matching system into hospices, into the Blackpool Foundation Trust, who provide community services to the Royal Lancaster Infirmary, and into the Rysedale care homes in Barrow-in-Furness. The Strata system is an electronic referral system. It cuts out the inefficiencies that staff have to deal with when they're using paper and fax referrals. The system speeds up the referral process, particularly helps hospitals with delayed transfers of care. So as soon as the patient is ready for discharge, the e-referrals will have enabled such as adult social care or care homes to prepare in advance for that patient's arrival into their keeping. Ultimately, it basically means the patient gets to the right place at the right time. It particularly benefits staff who are working with those patients to give them automatic access to a directory of services so that they aren't forever ringing around care homes, for example, or different organisations to find out where capacity is that the patient can be transferred to. So from both the staff and the patient perspective, it's a much more efficient process than, as I say, using paper and fax transfers. Another benefit of the system relates to the ability to view and book beds electronically. So we're in the process of rolling out across Cumbria with over 4,000 commissioned care beds, hospice beds and community hospital beds, step up and step down. Those beds, those vacant beds are put onto the system, enabling people with the authority to be able to book those beds in the knowledge that once the patient has been assessed, that they will have that bed available to them and can be transferred as quickly as possible. Well, for one trust, Morecambe Bay, and their three hospitals, we've already identified annually £400,000 of efficiency savings. It's basically cut out the use of paper and fax transmissions and all the problems that causes to receivers of information. So the efficiency side is particularly evident. Likewise, the quality of the information enables better relationships between senders and receivers. We've cut out the blame culture between health and social care staff, for example, much more harmonious relationships, which ultimately means that the patient, as I say, gets to the right place at the right time and, all being well, gets the right care.